Hi there. Welcome to Regulation Before Rehabilitation. If you are a clinician and you're interested in nervous system regulation, you are in the right place. I'm honored to have you here. I'm Kimberlea Smarr. I'm the founder of the BeWell Method, and I'm so excited to share this with you. To begin with, I want to read my mission and vision for the BeWell Method, and then we'll get started. The BeWell Method is to redefine rehabilitation through nervous system literacy. The BeWell Method equips clinicians and patients with accessible, evidence-based tools that regulate before they rehabilitate, transforming recovery from a mechanical process into a living, adaptive dialogue between body, breath, and brain. Our mission is to make nervous system informed movement as fundamental to healthcare as strength, mobility, and endurance, helping clinicians deliver results that last and patients rebuild trust in their bodies from the inside out. The vision is a healthcare culture where regulation and resilience are inseparable, where clinicians and patients speak the same embodied language, one that honors biology, choice, and the body's innate drive to heal. The BeWell Method envisions a future where every medical and movement setting includes a space for nervous system education, not as an alternative, but as an essential part of recovery. This vision is grounded in unity, bridging yoga and medicine, science and story, clinician and patient, one breath, one choice, one movement at a time. So with that being said, I would like to introduce myself just a little bit to those of you that don't know me. I am not a clinician. I am a teacher. I have taught therapeutic movement for almost 20 years. Most of that is through yoga, but 13 years of that, I also, in addition to teaching yoga, I was an acrobatic dance teacher. And with that, the program that I was trained inside of was recognized by Cirque du Soleil for its progression, for its safety, and for its integrity. I had little bitty people, 2 years old, all the way up to elite advanced dancers that I got to work with. And with that, just yoga alone, I have over 16,000 hours of teaching. I am a registered yoga teacher through Yoga Alliance. I'm a continuing ed provider also through Yoga Alliance. And I've got over 300 hours of advanced additional training through yoga medicine. I am also a master free diver. And the thing that I'm most proud of is that I have created a chair yoga program in my community. And that's been going for, it'll be 18 years this year. And I have some of the same students from 18 years ago that are still practicing with me. So this really is where my classroom was as a yoga teacher. I was able to enter into a space where there was no program, and I actually didn't have a lot of training for adaptability and modification. And so as I entered into a space where there were a lot of seniors, a lot of elders who needed modifications, I got to find a way. And together we found a way. And eventually, through all of that, what I started to realize is there's this through line, even as a teacher, that it's important for me to carry into any class I teach, whether I'm teaching advanced asana, or I'm teaching a restorative yoga class, or I'm teaching an adaptive yoga class, even when I was teaching in the dance studio. And what that is that in order to learn, in order to receive any kind of information, we need to be regulated first. That regulation comes before rehabilitation. I would say nervous system state comes before skill. But now we're working on looking at this in the healthcare system. And so regulation comes before rehabilitation. So what does it actually mean to be regulated. That's something that a lot of people misunderstand. So many people think that regulation is just to be calm all the time, which actually isn't true. Regulation, a regulated nervous system, is when we're able to toggle from an activated state when it's an appropriate response to a stimulus. And then from that activated state, from that heightened state, we're able to toggle back down into a calm, peaceful state. It doesn't mean that we're not activated. It means that we have like a dimmer switch where we're responding appropriately to the stimulus in front of us. But when we're dysregulated, what happens is that we get stuck. A lot of times it's that sympathetic tone, even if it's a low grade sympathetic tone, and we don't know how to turn it off. It becomes a light switch. And that light switch is stuck on, and it's an energy drain. So to be regulated is to be able to move up and down like a dimmer switch, and not only being able to show up in our lives and to have state of even anxiety, excitement, that's all appropriate. It's not bad or wrong, but that after that event, we're able to move back down into that state of calm, present peacefulness. But when we're stuck on, all the things are being addressed through this nervous system that's stuck in that on, if you will, state, in that sympathetic tone. So I propose that the nervous system actually is the patient. And the nervous system, when it's regulated, is going to receive data differently than when it's dysregulated. When it's stuck in that combative fight or flight, it resists because our nervous system is meant to keep us alive. I'm going to say that again. Our nervous system's number one job is to keep us alive. It's not for us to thrive. I think thriving is a creative act in the world, and it takes some skill. It takes some maybe technique or technology in order to thrive as a human being. And we're going to talk about what that means a little bit later. But I just want to propose that we really understand that our nervous system is designed to keep us safe and alive. And there are things that feel threatening to our nervous system that are even just perception and not real. So we'll talk about that in the three centers in just a little bit. So I want to propose the nervous system is the patient. So if we look at the nervous system state first, before we do anything, then what we can start to understand is how do we create a receptive environment? I think of it like a closed fist versus an open hand. Which one's going to hold more? So when you have all of this brilliant skill and technology and training and experience and expertise that you're trying to hand a patient to help recover them, and they're in a closed state, they're not in a place to receive it. So how do we start to open the hand and allow the nervous system to become regulated and open so that they can actually receive what's being offered without it being also perceived as a threat? So I want to share for a moment one of my clients, and his name is Greg. Greg was 70 years old. He needed 2 knee replacements. Greg is stubborn. He's a sweet guy, but super stubborn. Has worked in construction most of his life. And he came to group yoga classes for quite a while, even knowing that he needed his knees replaced. And eventually he got to a place where he decided that he was going to replace them. And we started to work together individually, calling it prehab. And with prehab, a lot of times, especially if you're in the movement modality space, you're probably thinking of like strengthening ahead of time. And yes, that includes that. But my job as a yoga teacher, as a nervous system regulator, is to really address first, how do we create an environment for Greg to thrive during this process and procedure? Because medical intervention, even though it's necessary, it's violent to our body. And our ability to perceive it and welcome it actually matters. So we started with Greg's mindset. We started to look at his belief system. And at first, he felt like he was sort of resigning to this procedure instead of choosing it. And we talked about, how do we reframe this? How do we really get to a space where you're choosing this? And recognizing, like, this is the right choice to get you out of pain. Your knees need to be replaced. And fortunately, thankfully, we have the ability to replace parts. And there's not a failure on your part. Our parts wear out. And thank goodness we have interventions and skilled surgeons and therapists and nurses and teams that allow us to replace parts and not be in pain anymore. So that was the first step. And then the other part is, we talked about all the people around him that are going to talk to him about their knee replacement. I've heard so many stories around people being very disappointed with what happened after their knee surgery. It wasn't what they expected. They can't kneel anymore. They're not necessarily out of pain. And he started to share these stories too, that he was getting that feedback from all these other people around him that have been through it. And so now we're starting to plant these seeds of, what is his experience going to be like? And I'm like, look, you haven't had this experience yet. You need to let that be their experience, and you need to stay curious to what your experience is going to be. And then we also started talking about trust. Do you trust the physicians doing the surgery? Do you trust the staff that is taking care of you? Right? And really planting all of these seeds so that when he was ready to go in for his first procedure, yes, we also worked with his feet and his spine, and we did some range of motion. But really, what the brilliance of all of this was, is that we prepped his nervous system for this experience. And when he was in surgery, or right before surgery, his wife told me this story. They were laying there, he was laying there, and, he was getting ready to go in, and he started to get afraid, which makes sense. And his wife was there, and Greg and I talked a lot about breathing, because sometimes that's the only thing that we can do. We talked about certain breathing techniques, about recentering. And so his wife said, remember your yoga breath. Remember the breathing that you and Kim talked about. And so the nurse overheard her saying that. And the nurse came over and she was like, yoga? This is so incredible. She said, I know yoga too. And she's like, this is so great. And all three of them are breathing together in the preparation room, getting Greg ready to go into a surgery. And our body is still receiving information, even if we are under anesthesia. And so to enter into a procedure like a knee replacement and have a nervous system that's welcoming the experience, that's trusting the staff, that's actively choosing this experience, is going to receive that procedure differently. So Greg came out of surgery after his first knee replacement, and at his first checkup with his doctor, check-in with his doctor, the doctor was really surprised at the minimal bruising, the minimal inflammation. He recovered really quickly. He was like a model PT patient. When he was cleared, him and I started working together again, really slowly. But one thing with Greg is, like, he was really stubborn about using props. He didn't want to use yoga blocks. He didn't want to use, a chair. And we really talked about, how then are you going to reintroduce movement if you're just going to cause resistance? How do we learn to find a way and welcome what's in front of us? And so Greg came back to class with a chair after we worked individually just a little bit. And he was able to use his chair and still come to class and do what he could because there's still benefit in doing things repetitively. And then eventually he got rid of the chair. He came back to his mat. And then a few months later, he had a second knee replacement done. And Greg is now, I think he's about 18 months, maybe almost 2 years post-op. And he's on his knees in class. He has some padding, but we talk about all the time, how do you show up? How do you pay attention? How do you stay clear? And that's with a regulated nervous system, you can stay curious to what your body can and can't do. You can stay curious without resisting and pushing and forcing. And so I think his recovery has been, I tell him he's my poster child. His recovery has been really brilliant. I have other clients that have had very similar experiences. And so it's like, how do these people, why do these people thrive and recover and become resilient and keep showing up in their lives? And how come other people perhaps have very similar circumstances and don't recover, end up in pain, feeling victimized by the experience? And I really think it's about addressing the nervous system. And we all know, the patients who can't focus, they won't follow through. If you do manual therapy where they're guarded, they flinch at touch. And that's the nervous system perceiving threat. So the way that I teach and I approach is that we have these three intelligence centers. The perception center is our mind. It's our thoughts. We're all very familiar with this. In fact, most everybody, even though we have a body, we're a giant head floating around. This is our perception center. This is the way we perceive the world. And this is where our thinking mind and our mindset lives. We have tons of thoughts every single day. Not every thought we think is true. And not every thought we have to act on or believe in. And that's really important, I think, for us to stop intellectualizing things like pain. And working with the perception center, right? When we start to shift our perception, like how we chose to look at Greg's mindset first, it's like, what are you choosing here? Are you choosing the surgery or is it being done to you? Those things actually matter, that we shift the perception center. The second center is the feeling center. It's the heart. And it's related to the vagus nerve in the training that I do. And the heart has neurons. The heart has brain cells. It's like 40,000 brain cells in our heart. But guess what? Our heart doesn't have thoughts like our mind. Our heart has feelings. So we have a feeling center here. It's a truth teller. And then the body, I use the enteric nervous system. So that's the nervous system in our guts. It's considered the second brain. The enteric nervous system is our sensing center or a moving center. And just like the heart, our body doesn't have thoughts. It has sensations. We've all had butterflies in our stomach before. That's your enteric nervous system sending you a signal, because sometimes our body knows before our mind does that something's not okay. When my kids were little, it was like their tummies were the truth tellers, right? We probably all experienced that. And the really cool thing is your enteric nervous system, which is in your belly. I've got my camera a little high there. It's in our belly. Has more neurons in it than your spinal cord does. It's wild. It's considered a second brain. It produces most of the serotonin in your body. Serotonin is our contentment molecule. So This center is our action center. And I want to also move back to the perception center. We're not going to think our way out of thoughts. We're not going to think our way out of our emotions. The only way is through action to start to create a disruption and a redirection of the mind and the heart. So being able to take action in our lives is so important. But what do you do when you are recovering in bed, right? Well, the one action that you can take is the breath. The breath is always with us until it's not. And when it's not with us, well, we really can't do anything anymore. So there are 3 pillars in the BeWell method. And the first pillar, or the first lever, if you will, is the breath. The second is the spine, and the third is the feet. But this training is about looking at the breath and how the breath is the first lever. And I think that there is a lot of interesting information around the breath. I think that there's some breathing practices, that are helpful and therapeutic. But I'm more interested in every breath you take all day long, because you breathe 22 to 24,000 times a day. What else do you do consciously that many times a day? Maybe you blink your eyes. I don't know. That's the only thing I could come up with when I pondered that myself. So, seeing that, then, how then do we use that lever in real time, or we use that as a piece of education around our nervous system? Because our breath is a direct reflection. The state of our mind is a direct reflection of our breath. I want to say it that way. I'll say it again. The state of our mind is a direct reflection of our breath. If our breath is erratic, our mind is erratic. And here's the thing: your nose is for breathing, and your mouth is for eating. And your nose is the beginning of your respiratory system. Your mouth is the beginning of your digestive system. So if we're breathing through our mouth, then what happens is we're using a part of our body in a way that it wasn't designed to be used, and that sends a signal to our nervous system that things are not okay. So I always say the nose is for breathing, the mouth is for eating. If we switch to nasal breathing, there's lots of things that happen instantaneously. It slows our breath down. It humidifies the breath. There's nitric oxide, which is a gas in the body that's produced in our nasal passages. And nitric oxide enhances circulation and oxygen delivery. So if we're dealing with somebody who needs healing, then increasing oxygen delivery and enhancing circulation, isn't that what we want? So this is low-hanging fruit in the clinic. Mouth breathing creates a sympathetic tone. That's that fight or flight. That's that upregulation, because your body is sensing, oh no, I've used plan B now, because plan A, our nose, right? That means everything's going well. Things are okay. The breathing through the nose slows the breath down naturally. Breathing through our mouth, we speed things up. We start to, it's called over breathing, which sounds really wild, but most people over breathe. And our ability to start to release carbon dioxide, but release it slowly, is another benefit in our blood chemistry and our body chemistry that keeps everything happy and content, and is sending signals and reinforcement back to our nervous system that things are okay. So the other thing is that our need to breathe, right? We feel like we need to take a breath, doesn't actually come from a lack of oxygen. You have a lot of oxygen in your body. It comes from the rising of carbon dioxide. I learned this when I was free diving, and it kind of blew my mind. Um, did you know that your thoughts create a chemical byproduct? Your thoughts create CO2. So if we have a lot of thoughts going on, that's an increase of CO2. And if that increase of CO2 is what makes us need to breathe, then being able to let go and lengthen our exhale and start to move the carbon dioxide out of us slowly gives a signal back to our nervous system that we're okay. So there's these small interventions like that that are low hanging fruit in the clinic that just knowing something as simple as nose breathing versus mouth breathing, you could see that immediately and start to encourage your client or your patient to shift over to that. And now the thing is like you probably don't have time to give them the whole education around it. And so that's where I get to intervene in the BeWell method. And I'll say a little bit more about that. You can know all of this, but do you have time to teach it? I think we should all know this, but your expertise isn't necessarily in this, but even for yourself, nose breathing throughout the day, start to check it out. Start to notice, do you mouth breathe? Can you switch when you catch yourself back to nose breathing? And even just noticing that is huge. That mindfulness and presence that brings, you're like, oh, I'm mouth breathing. Let me take a deep breath. So, with that, I would like to take us into a really quick breathing practice together. This is an extended exhale breath. And we're going to start with our hands, one hand over the heart and one hand over the belly. Now, this is holding the feeling center, and the bottom hand is holding the sensing or the moving center. We'll start here, and if it's comfortable, close your eyes or just gaze downward softly. Take a moment to feel both of your hands on your body. As you notice the feeling of the light touch of your hands on your body, gently seal the lips, soften the inside of your mouth, relax your tongue, soften your eyes, relax the back of the skull, right around the brain stem. See if you can soften that skin right at the back of the neck. And then bring your awareness back to your two hands. As you inhale, take your breath down into your bottom hand and then breathe up into your top hand. As you exhale, let both hands move towards each other as you breathe out slowly. Inhale, fill up your belly, fill up your heart. Exhale, soften your heart, soften your belly. Inhale, belly, heart. Keep the mouth soft. Exhale, heart, belly. Inhale, notice the hands move away from each other as you breathe in, slowly filling up without creating tension. As you exhale, notice the hands move towards each other. A couple more rounds like that. Inhale, those 2 points move away from each other without any rush. Soft, slow. Exhale, releasing the breath out. Notice the hands move towards each other as you soften into your seat. Release your hands and just keep that awareness of where the hands were on the body so that the mind can trace the breath as you inhale. Those 2 points move away from each other. As you exhale, those 2 points move towards each other. Inhale for 4 counts. 4, 3, 2, 1. Exhale for 6, 5, 4, 3, 2, 1. Inhale 4, 3, 2, 1. Exhale 6, 5, 4, 3, 2, 1. Inhale 4. Exhale 6. Inhale 4. And exhale 6. Take one more breath like that. Just slow, gentle inhale. 4 in. 6 out. And then let your breath return to whatever state it wants to be in right now. Just noticing the breath in and out through the nostrils. Notice the inhale is a bit cooler and the exhale is warm. Just letting the mind fall into the breath there. Good. And when you're ready, go ahead and blink your eyes open. Just notice your state. Notice what it feels like for a moment. Notice what's softer. Notice maybe what feels a bit more alive. So in session, maybe you have time to offer that, maybe you don't. Over the years, I've taught thousands of students, and I've really fine-tuned how to teach the breath. So not only is it a matter of, counting and telling people how to breathe through their nose, it's also exploring things like how do we use the diaphragm efficiently instead of the stressful top of the chest muscles, our secondary respiration muscles, which most of us are up here. Again, that's a signal to our nervous system that things are not okay. Those muscles that take you up here in the breath are important for things like running away from danger. We want that capacity to pick up the rib cage and to take more oxygen in. But if this is where we're breathing all day long, that's 22 to 24,000 signals to our nervous system that we're being chased by a saber-toothed tiger or something. So those things, mapping out what is an actual full breath, a calm breath feel like, is something that over the years, like I said, I've created a really peaceful way to help people experience that, a really detailed way. Because saying take a deep breath in the clinic isn't helpful. Sometimes people have never taken a deep breath that actually did anything except excite them more. So the BeWell Method itself is a patient library that you get to utilize and prescribe from. There are 4 levels in the patient library, and I'll talk about that a little bit more. But I want to first talk about what this partnership is, because like I mentioned, I'm not a clinician, I'm a teacher. The way that this partnership works between the BeWell Method and you is that you're the surgeon and I'm the anesthesiologist, and I'm here with my skills, my knowledge, my tools to prepare the patient for your work. That way, they're ready for you. Could you imagine somebody going into surgery without anesthesia? Right? That used to happen, and it was quite violent and terrifying. And I'm sure even for the surgeon itself to be able to perform something with accuracy and precision was much harder. So the BeWell method is the sort of anesthesia, if you will, for your surgery. The surgeon needs to know, right, that the anesthesia is working. They need to know enough about it. They need to know when it's working, when it's not working, but they don't need to administer it. That's my job. So neither replaces the other, but both are essential. You're the expert at what you do. I'm not here to replace that or to intervene in any way, except I'm here to offer ways to actually prepare your patient, your client, for the work that you're doing. And whether that's behavioral health or it's physical therapy, occupational therapy, right? Anything at all, a regulated nervous system, somebody who has that capacity to regulate their nervous system comes into your care goes further. We open their hands to receive what you have to offer. So the BeWell method, like I said, is a patient library. The actual product itself is over 63 patient practices that are leveled in 4 levels. The point of the library is not to get to level 4. There's no like gold star that you get to level 4 and you're done. What this library does is it gives you this full library of practices for anybody. Level 1 primarily is about the breath. And if that's all anybody ever gets to, I think we're winning. If we can get people to nose breathe, to understand how to calm themselves down in real time, how to regulate themselves, how to understand that they're more than their brain, so they're not intellectualizing their pain, that they're actually able to drop back into their body and discover and explore it, I think that's gold. And so the patient library is there to do that. It's not to progress them. And as the library does progress, it is progressive. Maybe they get to level 2 or 3 or 4, but the point isn't to progress to level 4. It's to give them skills and tools and habits that they take into their life in between sessions with you, but also into and beyond your care. Because we all know the only way to actually shift the nervous system state is to do things regularly. It's our habits. So nose breathing, right? That's the first habit we start to shift into. Nose breathing. You have 22,000 habits all day long that you get to practice. That's a beautiful place to begin. It plants the seed. And then from that, it maybe expands more into this ability to perceive inside. We move to the spine and the feet and moving, breath to movement. So how this actually all works in order for you to get the library is you do a training. It's an on-demand training. You can take it as you need it, and it's less than 3 hours. And what it does is it prepares you to use the library. It's not training you as a yoga teacher, as a nervous system regulating movement specialist. Like it's none of that. I'm like, let me do that. Let me be the anesthesiologist. But you need to know, right, what's going on with the work that I'm doing, and you need to understand how it's built and how it progresses. So then you can use the library. And so then you can either prescribe very specifically from the library, I want you to do these practices. And it's very simple. It's a QR code. Patient scans it, and they have a 12-week access to the patient library. Or you say that you really value nervous system regulation inside of your clinic, and that you want to have them participate in this program, and they can be self-guided in it. So I've got my hand raised. It looks like that's interesting. Anyway, coming back to it, the library then can be very specific, and you can understand and know the library in a very detailed way and know exactly your patient and what they need. Or you can use it very generally and offer it to them, and it's self-guided. So there's like two really great ways to use it. Another way that I envision it being used, and this is where I need your feedback down the road, is that in clinic, I think this could also be utilized. I think that a patient waiting for their appointment to see you could scan the QR code as they sign in and go and do a 5-minute breathing practice, because that's the other thing. These practices are very small. They're digestible because over the years, the things that are repeatable and digestible is what actually shifts and changes us. So it's that little by little, again and again. We don't want to overwhelm people. We want to give them very simple things that actually truly are effective, like nose breathing, and reinforce that. So they come into your clinic, maybe they scan the QR code and they do the breath practice that you assign them. There's a breath practice that research has shown that modulates pain, and it's a 5-second inhale and a 5-second exhale. Maybe you know that they're struggling with pain and you want them prepped for you. You do that. So that's an option, right? And then in my head too, I'm like, in clinic, wouldn't it be interesting if you get a client coming in and you intuit, which many times you do, you're like, wow, they have had a bad day or they are dysregulated. And in real time, anything I do, it's just not going to land. And so maybe they're on the table ready for manual work that you're going to do. And now you know that that's going to be received perhaps as a threat, or they're going to guard or protect, or it's going to be extra painful, or they've already decided it's going to hurt. Maybe you have an iPad and you click on a practice that takes them through the 3 centers and breath and gets their nervous system settled. And then you do it. And it's 5 minutes. It's 5 minutes that could take your session from being not valuable to valuable, and you don't have to teach it. If you want to teach it, beautiful. Once you have the information, of course you can integrate it, but you probably need to spend your time in the way that you are already experienced and trained and already do amazing things with. So that's how the library works. The product itself is a patient library. 63 patient practices that are progressive. And the clinician training, like I said, is just under 3 hours. It's self-paced, it's on demand. There's 5 phases. And even for you, there are 20 lectures. That sounds like a lot, but they're very bite-sized. That way you can like just hear, grab, understand the way that all of this has been designed and developed for you to help your patients. The founding member price is $599 a year, and that's for a license to use the library. And that license gives you, as a clinician, unlimited patients. You're not paying per patient, you're just paying for the license for the year. And so with that, one clinician, unlimited patients. Every single patient that you have can use this. It's set up right now for 12-week access per patient. And sometimes that's not enough, especially if you're in behavioral health therapy and you're not in a modality like PT or OT. That can be extended. So that was just sort of the initial thought process of let's, create this for the patient and hand it off. But then it also gives them a boundary to work inside of. Within 12 weeks, I want to see that your nervous system now is in a different state. The reason for the incredible discount on the license right now is because I want feedback from you guys. I want partners who want to develop this because eventually I want to develop feasibility so it can be studied and researched. So I have this soft launch happening right now. If you feel like it's valuable, if you feel like maybe this is the missing piece for you or your clinic, I would love to have you. Right now, I have the founding cohort timeline is April 30th. So reach out, let me know if you're interested, let me know what you're learning, what you want to learn more about, and I'd love to still offer more of these free webinars. But I'm really, really excited to share this with the medical world because I think that this is the next evolution. So thank you so much for coming. Thank you for listening. Please share this if you feel like it's helpful for anyone. And I can't wait to hear from you. This is what's next, and I hope you're a part of it. Thank you.